the suite of dentistry-specific educational resources developed at JCU. These resources are designed to support training of dental students and dental practitioners to care for patients who are experiencing or have experienced domestic and sexual violence, utilising a trauma-informed approach. My name is Felicity Croker, and I've been part of the interdisciplinary team developing, delivering and evaluating domestic violence education for dentistry students since 2015. I'll open tonight's webinar with an acknowledgement of country. At JCU, we acknowledge with respect the Aboriginal and Torres Strait Islander peoples as the first peoples, educators and innovators of this country. Tonight we're presenting from the lands on which our research and teaching conducted in the Cairns region. We pay our respects to the traditional owners. We're on the lands of the Japagai, the Gimoi, Walabara Yidinji and the Irukandji peoples. We pay our respects to their elders, past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people attending this event. This project is funded from a Keeping Women Safe from Violence grant from the Queensland Department of Justice and Attorney General. This Keeping Women Safe from Violence initiative aligns with the Not Now, Not Ever report, putting an end to domestic and family violence in Queensland. That report recommended that all health professionals receive domestic violence education. This project also contributes to the national plan to reduce violence against women and their children. I'd like now to introduce our team. I'm Felicity Croker. Dr. Anne Carrington, who is one of the leads on our research project and also brings her social work perspectives. She will be introducing the videos and the print resources. Dr. Alex Danziger, who is a dental practitioner and has a JCU graduate and clinical supervisor, adds her valuable insights to research and teaching. Dr. Vanita Mosby, lecturer in social work, who adds her invaluable and insightful contributions as a First Nations advisor. And our wonderful research assistant, Simone Dewar, who is also a social worker. Simone will be managing the question and answers tonight. We ask you to please type your questions into the Q&A box at the bottom of your screen, and these will be collated and answered at the end of the presentation by Simone and the other members of our team. To open this session, we have 3 guest presenters, followed by an overview and introduction to the project and educational resources. And as I mentioned, we'll respond to the Q&As at the end of the session. We're going to acknowledge some of the amazing people who have been part of this project at the outset. This collaborative project has developed innovative educational resources involving many people from dentistry, social work, domestic and violence sector. In particular, we sincerely appreciate the contributions from social work at JCU, the College of Medicine and Dentistry, the JCU Dental Clinic, the Cairns Regional Domestic Violence Service, who have been our partners since 2015, the Warringah Aboriginal and Torres Strait Islander Corporation, Be Conscious, Ewan Cutler and their wonderful team at Hudson Films, and the dentists who provided their expert advice, including Associate Professor Andrew Lee, who will be talking to you tonight as one of our guests, and Dr. Julie Birch on behalf of the ADA Dental Health Foundation. We also acknowledge the contribution of the victim survivors of domestic and sexual violence who generously and courageously have shared their stories. And we acknowledge all those who've been harmed or killed in the context of domestic and family violence. We're aware that amongst you, there are those who are attending this launch who will be colleagues or with their own experience of violence, either personally or within their families. Please consider self-care and access support if you feel emotionally impacted by anything that we're discussing during this presentation. I would like to now introduce Professor Richard Murray to open this launch. Richard Murray is the Dean of the College of Medicine and Dentistry and has been a champion of our program for many years. Thank you, Richard Murray.
Look, thank you very much, Felicity, for those opening comments. And yes, as you say, I'm the Dean of the College of Medicine and Dentistry at JCU, and perhaps I might just say a few words to explain a bit about who we are and maybe why this program and how it came about is not such a surprise. The college and really the university more broadly is the sort of place that attracts people who share a passion for a purpose in career, purpose in study. So And that purpose for us is formally the promoting health and strengthening healthcare for communities of Northern Australia and beyond. That includes socially accountable health professional education, discoveries, partnerships, advocacy, and leadership. And I think all of those things are well illustrated by the work that we're discussing tonight. Since the establishment of dentistry in 2009, and at the time it was Australia's equal first regional dental program, Charles Sturt and ourselves started in the same year, we've earned a pretty distinctive reputation for educating tomorrow's rural and regional dentists. We're also responsible for greatly increasing the number of Aboriginal and Torres Strait Islander dentists. The dental program continues to attract learners, practitioners, academics, partners who seek to make a difference in those theme areas in our university: remote, regional, underserved communities, tropical medicine, Aboriginal peoples and Torres Strait Islanders, global health. And really, along with the other health professional programs in the college, dentistry is really among the leaders in the sector in terms of not only graduate impact, but also the student experience. We emphasise the recruitment of learners from and educating and training them in and with underserved communities, whilst also seeking to attract those who seek studies in a fulfilling career with what you might say is adventure, skills, and impact. So the leadership and development of dentistry-specific domestic and sexual violence resources has arisen from this values-orientated context. It reflects an orientation to social accountability in addressing priority community needs. As we know, family and domestic violence, sexual violence is present everywhere, of course, but unfortunately it is more prevalent in remote and rural communities and also in Indigenous Australian communities. We know that the physical evidence of violence is often manifests in the context of oral healthcare too, but too often in the past, practitioners lack the skills, knowledge, and maybe above all confidence to be able to respond appropriately, and opportunities for effective intervention, supporting those who are victims of family violence are missed. So look, I'd like to acknowledge the passion and commitment of Felicity with Anne Carrington and the Cairns Regional Clinical Violence Service staff, and the early clinical champion, Andrew Lee, did the foundation work here, and it's enabled these important developments. And as Felicity's mentioned, I thank the Queensland Government for funding provided under the Keep Women Safe for Violence program. And that's enabled, of course, the development of these excellent resources. So look, I'm delighted that the product of this work is now able to be shared more broadly for the benefit of families and communities across Australia and indeed beyond. I commend it to you and I thank you for your attendance at this important occasion for the launch of the resources. Thank you, Felicity.
Thank you very much, Professor Murray, and thank you for placing this project in that context and for your endorsement of it. Thank you so much. I'd now like to introduce you to Associate Professor Andrew Lee. Andrew Lee, as I mentioned, was the Associate Professor of Preventative and Special Needs at James Cook University, but he's also the Joint Head of Department of Oral Medicine and Special Needs Dentistry at Westmead in New South Wales. Thank you, Andrew.
Very much, Felicity. I've spent most of my career in the service of vulnerable populations. The first years of which were as a community and remote dentist working in the Territory, firstly in Alice Springs and then in Darwin and the remote communities at the top end. I saw firsthand the consequences of domestic and family violence, and as a new grad, I often felt overwhelmed and uninformed in how best to proceed. What were my legal responsibilities? Was it my place to interfere? I was new to Australia and new to the cultural complexities of working with such a diverse group of Australians. Was there anything I could actually do? If I interfered, was I going to make things worse? I'd learned previously that the road to hell was paved with good intentions, and that well-meaning, ill-informed blundering could indeed make a difficult situation even worse. The Australian Dental Council guidelines, from which all dental school courses are accredited, includes domestic and family violence in 3 domains of its list of competencies, reinforcing that this issue is indeed part of our responsibilities as oral health professionals, and that we should know what we're doing when encountering a victim of domestic and family violence. Whilst the oral health professional may be alerted to the physical signs of violence, as clinicians, we often drop into autopilot to address the dental problem. It is important to remember that this is the tip of the iceberg when it comes to such a complex issue. Yes, dental trauma may require immediate management. However, we should not be distracted from the cause. As these educational resources demonstrate, it is not only physical violence we need to be on the lookout for. Some signs may be far more subtle, particularly as the victim is likely to want to disguise them. As much as domestic and family violence often presents as violence against women, it is important to be reminded that it is not always a female victim and a male perpetrator. Our clients are not just statistics, and we need to be prepared and vigilant for the variety of situations and presentations in which this may occur. I've been lucky enough to be involved with this incredibly valuable project, lending my own experience and lens to this educational resource. I think what is most impressive are the lengths to which the authors have gone to ensure authenticity and their collaboration with a wide range of stakeholders. With more than 3.8 million Australian adults having experienced domestic and family violence, if we have any hope of addressing this endemic social problem, both our clients and our fellow colleagues need agency. It is, as always, an absolute pleasure to work with such an innovative and dynamic organisation on such an important educational resource. Thank you.
Thank you so much, Andrew. That really appreciate your putting this in context again from a dentistry perspective and providing those insights.
Thank you.
I'd like to now introduce Professor Lucy Jordan, who's a Professor of Social Work at JCU. Thank you, Lucy, for adding your perspective from a social work area.
Thank you so much for the invitation, Felicity and team. So yes, welcome. We're so delighted to see so many people tuning in to this session at the end of a workday in the middle of the week, and probably taking time out of time for maybe recuperating from the day's work or visiting with close ones and loved ones. I'm delighted to be able to be here and welcome on behalf of the academic group in social work and human services at James Cook University to represent also our discipline. I was just joined JCU actually in January, so was relatively new to this context, but I had heard about this project a year ago when I was visiting. And I had the opportunity at that time to meet briefly with some of the team and to hear some about it. And I was struck again by just the importance, the salience of this kind of collaboration, both for the local region, but also just sort of more on the bigger stage of the world, thinking about the importance of kind of frontline practitioners of an interdisciplinary nature being able to feel ready, to respond to things that will come into their door. I believe strongly that one of the main commitments of social work profession is to facilitate these kinds of interdisciplinary meeting places, and to bring the lens of social justice, respect for persons, and professional integrity that are core to the ethics that are enshrined in the Australian Association for Social Work Ethics Principles, both to our own practices, but also to our interdisciplinary teams. The most recent kind of a curriculum endorsement from the AASW in response to domestic violence specifically is from 2018, where there was a position paper as well as a curriculum best practice guide. So there is a commitment in Australia to ensure that social work is bringing this perspective and this voice to their practice. But in addition, I think that we have the uniqueness of James Cook University, and in particular, the Cairns campus, where my former colleague, Dr. Ann Carrington, was for many years a leader in this space, working in trying to bring new awareness and new solutions in a community-led approach of advocacy and collaboration to making changes in the prevention as well as the intervention of domestic violence. So I just really on behalf of the team, am delighted to be able to acknowledge the contributions of Dr. Ann Carrington as well as the whole team in securing the funding and implementing the project, bringing a very important focus on the salience of considering the social context and also the collaborative approach to locally led solutions. And of course, as well, I'm so always happy to see practitioners and teachers such as Simone Dewar involved in providing research assistance to help do kind of the legwork and bring in the practice voice to make sure that everything goes as planned. And I hope that this kind of collaboration is not going to be coming to a close just because this particular project is. My greatest wish would be to see further collaborations with dentistry, but also with other allied health groups going forward in ways that we can just try to amplify. I think because to me, that's a big part of what collaboration is about. I think with social work discipline and other disciplines is that we can amplify the unique approaches that each of the disciplines bring when we are able to form lasting and sustainable collaborations. And so yes, I'm just delighted to be able to say welcome and a big gratitude to everyone for this successful launch. Thank you very much.
Thank you, Professor Jordan. As you say, the interprofessional collaboration is what has made this so unique and so outstanding. We could not have developed these resources without those knowledge, skills, and perspectives. So we're very grateful to social work. And as you say, Simone Dewar, who's our research assistant, brings incredible skills. But on that note, I'm also now going to introduce Dr. Ann Carrington, who thank you for your endorsement. Anne.
Thank you, Felicity, and all those who have helped to introduce this launch this evening. As has been mentioned, we've been teaching domestic and sexual violence curriculum to the dental students within the Bachelor of Dental Surgery here at JCU since 2015. The initiative started as a response to students requesting content on this topic based on feelings of unpreparedness with what they were facing out in clinical placement. The Dentist Domestic Violence Recognised Responder for the program has been a successful collaboration between JCU Social Work, JCU Dentistry and Cairns Regional Domestic Violence since that point. When we started in 2015, this was a new space for dentistry in Australia, and there was very little to no dentistry-specific content available. Much of what is in our program has been developed from the team's shared professional expertise and informed by student feedback through research and evaluation. Domestic and sexual violence is now nationally recognised as important to dentistry, with the ADA policy statement outlining that dentists have a vital role to play in providing a safe, compassionate environment for patients in their role in the detection, intervention and provision of advice to those suffering the consequences of abuse and violence. Further, the Australian Dental Council has now included domestic and family violence in Competency 2.4, which requires that dental graduates are able to competently recognise, assess and respond to domestic and family violence risk, prioritise safety, provide information and refer as required. Next slide, please. Oh, sorry, we're 2 slides ahead. Apologies. And next slide. Thank you. So research and evaluation of the DDV-RRR program identified a gap. Our students identified there was a need for dentistry-specific resources as they were having difficulty seeing how they could implement what was being taught into their regular dental practice. As this was new to dentistry, we were having to draw simulated examples from other disciplines such as medicine and midwifery, but dentists have unique environmental contexts such as the chair, instruments, and the potential re-triggering effects of standard dentistry practice on many victim survivors of trauma. So in securing the Keeping Women Safe from Violence grant, we were able to expand on our interdisciplinary team's expertise and collate, analyse and utilise data from a broad cross-section of stakeholders to inform the design and development of these dentistry-specific educational resources. The key stakeholders included domestic and sexual violence and human service workers, Bachelor of Dental Surgery students, dental practitioners, educators and clinical supervisors, and First Nation Australians and culturally linguistically diverse health professionals and human service workers. Next slide, please. The interdisciplinary approach and the inclusion of social work theory and practice in the successful DDV-RRR program also underpin the Keeping Women Safe from Violence project and the development of the educational resources. The Australian Association of Social Workers in 2018, 3 years after we developed the DDV-RRR curriculum, released the Family Violence Curriculum Best Practice Guide. This document validated the approach that we had already been implementing. Underlying social work theory and content, as supported by those guidelines, include theories such as critical theory, feminist theory, gendered analysis and intersectionality, to name a few. And other important social work concepts informing our teaching and this project include social and structural rather than individualistic understandings of domestic and sexual violence, a biopsychosocial assessment, interpersonal skills, and pedagogical approaches. Next slide, please. Oh, I seem to be missing a slide. So are you able to go back a slide? Maybe I've jumped ahead. Okay, I'll talk to this slide now, apologies. So as a result of the Keeping Women Safe from project, we have produced a suite of high quality dentistry-specific resources, including 6 different video scenarios with accompanying print resources for each. Our students have already benefited from these new resources in 2024, teaching of the DDV-RRR program as part of the formative evaluation for this project. Based on their feedback, the feedback of our experts in dentistry and domestic violence sector, and our own reflections on teaching with the new resources, they have now been further refined. This evening, it is our great honour to launch these resources, making them available to all, including the scenarios include, next slide please, the basics, which explores the foundational concepts and covers the basic skills required to recognise, respond and refer appropriately. The full skill set, which provides a more developed set of skills and knowledge, including concepts around trauma-informed practice, some ethical and legal considerations. Next slide. Trauma-informed approach, which with a specific focus on how to engage with a patient from a trauma-informed approach to minimise re-traumatisation and the triggering of trauma after a disclosure. Legal and ethical considerations has a targeted focus on informed consent, information sharing and mandatory reporting. However, all of these different videos continue to build on those basic skills. So they include all of those basic skills, develop them and add those specific focuses. Next slide, please. Working with First Nations Australians explores the complexities of responding to domestic and sexual violence with First Nation Australians, exploring the ongoing impacts of colonisation, intergenerational trauma and systemic racism, and how these contribute to the current rates of domestic and family violence within First Nation communities. Before we continue, we would like to acknowledge the invaluable support and guidance we received to assist us in developing this set of resources. From our research team, Dr. Vanita Mosby, locally Warrangoo Aboriginal and Torres Strait Islander Corporation, supportive friends from the Mount Isa community, and the First Nations people who were research participants in our design phase. We would also like to acknowledge that we made the decision this evening not to showcase elements from this set of resources, as the concepts covered are complex And with the limited time available, we would not be able to unpack and provide the appropriate level of attention to the multi-layered issue that informs work in this space. However, we strongly encourage you to view the video and the print resources, as there is fantastic detail and information in those resources. Finally, we would like to acknowledge that it is impossible to make one resource to demonstrate the nuances relevant to different First Nations communities. These resources are a starting point to help guide your thinking of your own and your own research relevant to your geographical area. The final video is considering unintended consequences, and this last video has a targeted focus in exploring unintended consequences, utilising the circumstance where the potential perpetrator presents with the victim survivor patient. Next slide, please. So content changes slightly in each print resource to help highlight the specific content, which is the focus of each of the scenarios, but common across all other sections listed below, which you'll find in all of the print resources. Next slide, please. The educational resources have a level of scaffolding of concepts, but there is a lot of cross-referencing to allow for flexibility to change the order or even use in isolation to work in with requirements of different training programs. So we've really made sure to build these resources, not just for our own program, but so that they'll be ready to be adapted by others. The order outlined in the print resources is aligned with our current scaffolded approach in the DDV-RRR program. And we have indicated here on the slide which resources we currently use at the different points in our program. So there's one in the third year, 3 in the fourth year, and the final 2 that are looking at the more complex elements, so encouraging critical thinking, are in that final year. For more information around the structure of our current program, we encourage you to review our publications. We will now look at some short clips and highlight how the print resources can be used to support the relevant scenarios. And we're going to start by taking a quick look at a short clip from the basics video.
In this scenario, we'll demonstrate an example of a dentist picking up on indicators of physical violence and their attempt to broach the conversation with the patient. As the patient is brought into the room, the dental team notices that they appear anxious and a little withdrawn, so they do their best to build some rapport quickly and apply their interpersonal skills.
Feel free to take a seat for me. God, I don't remember when it, rained this much. Have you had to change any of your plans because of the weather? Well, I can see that you haven't been to this clinic in a little while, so how may I help you today?
I was running in the rain to my car and I slipped and I hit my face on the car door, and now my tooth's really wobbly and sore.
The dentist sees that her upper lip is lacerated and bruised.
Ouch, that, does sound very painful. We'll see what we can do for you today to get that sorted. Now, just because you haven't been back in a little while and before we get started, I'd like to collect some updated information just to make sure we can provide the best care we can for you. Now, some of this information may be sensitive, but just know that all information disclosed today will remain confidential to this practice, unless you tell me about any current child abuse, childhood sexual abuse, or if I'm concerned that you are in any immediate or significant risk of harm to self, others, or by others. I apologise, I know that's quite a lot of information to throw at you at the beginning of an appointment. I'm more than happy to repeat any of that again. Do you have any questions for me regarding any of that at the moment?
No, I don't have any questions right now.
We know that many women do experience violence in relationships that can lead to different health or dental or other problems. So this is just a routine question we like to ask everybody to make sure we're able to guide our treatment as best as we can. Have you ever, or are you currently in a relationship where you have a partner threatening or has ever threatened to hurt you at all before?
No.
No? Okay, well, thank you for telling me. With that, we'll get started with the examination now if you're comfortable.
So in that clip, we saw the dentist screening for domestic and family violence or sexual violence. And later on in that video, we see the dentist actually opening up the conversation. And in that opening of the conversation, the dentist informs the patient that they have had training in domestic and sexual violence. And that training can include things that are covered in our print resources, such as the types of domestic and sexual violence, indicators of domestic violence, red flags, dynamics, the gendered nature of domestic violence, and underpinning social theory. The image on the slide at the moment demonstrates or shows the cycle of violence from the print resources that helps to understand the dynamics present in a relationship where somebody is using power and control. This can be an important resource and important underpinning information for a dentist to understand, as it may help them to understand where a patient is at the time that they may be seeing them. Next slide, please. So in this clip, as I mentioned, we saw the dentist utilising a script for screening. Scripts are an important part of the learning process, especially as people develop their competence and confidence. However, we do encourage everyone to make the scripts their own, using language comfortable to them. However, it is if you do try and use that language and reflect your own, we do encourage people to be aware of any unintended biases or myths that might creep in. So being critically reflective is important, and that is a section that we have throughout all of the print resources to encourage people to engage in that critical reflection. Scripts are in the relevant print resources and separately as an additional resource titled Quick Reference Guide. So the Quick Reference Guide has only the scripts available in it, and it can be really helpful to save it on the desktop of your computer, so that if you are faced with a patient who's experiencing domestic and family violence and you are feeling a little bit unsure, you can discreetly and easily open that document for those prompts to remind you about how you might open that conversation and what language you might use. Next slide, please. I think we're about to head into viewing another clip for trauma-informed video.
Again, I'm so sorry to hear this. I'm glad you're able to tell me this today. There are many forms of abuse, and we know that sometimes being at the dentist can be really triggering. First, I want to check if you know there are any services that you can speak with for support.
Yes, I'm talking to a DV worker at the moment who's helping, but thank you for asking.
I'm glad you're speaking with someone and getting support. Before we start your treatment today, I'm going to ask you a few questions about what might trigger your trauma. That way we can better adapt your dental procedures. But like I said before, on the whole, the information you share with me today is confidential to this practice. I do take notes about your dental health, the dental injury, and the dental procedures I do today. And from a trauma-informed perspective, I can write down the information about your experiences of domestic and sexual violence, and that your ex-partner caused your dead tooth. It can be useful to keep full details for the next dentist, and if you ever decide to go to the police or apply for victim support. Do you want me to include these details today?
Is this information going anywhere else?
Unless subpoenaed or you request to share your records, the information will stay on an electronic database which is protected by a password. It is only accessed by staff for future dental procedures. Do you need more time to think about this?
No, that's okay. I can make my decision now. I want you to include all the details I've told you in my file.
Sure, I can do that for you. Also, with your permission, it would be helpful to take a clinical photo for your record. Is that okay?
Yeah, that's fine.
Before we begin your dental exam, I'd like to go through a few things that might make you feel more comfortable here. Just to check, are you comfortable with me? Or if we can get someone else of a gender that you'd prefer.
No, that's okay. But I am feeling quite anxious today. I don't like it when things are around my neck or my mouth, especially when I'm lying down. It makes me feel uneasy and scared.
I've got some suggestions for your concerns, but first I'd like to hear if you have any suggestions that might help you.
Is it okay if we don't have the tie around the bib and you let me know when you put the sucky thing inside my mouth?
Sure, we can do that. I've also had a few patients in a similar experience that like to use a blanket to make them feel more comfortable. Would you like to use a blanket today?
Yes, that would be great.
Sure, and I'll start the procedure in a more upright position. Would that make you feel more comfortable?
Yes.
So as you can see, even within that very short clip, we've packed a lot into each of these videos and resources. So I'm just going to pull out a few different points that could be highlighted. So here, the first one is around trauma-informed being parallel with recognising, responding and referring. So dentistry is a known trigger for many victim survivors' trauma. As such, and given the numbers of 1 in 3 people who've experienced some form of trauma in their lifetime, we would advise that a trauma-informed approach should be underpinning all dentistry practice, but certainly the implementation of recognise, respond and refer. Once immediate safety and referrals are complete, if a patient has disclosed domestic and sexual violence, then the dentist should turn their attention to minimising re-traumatisation and potential trauma triggers. Next slide, please. So mitigating power over is important in terms of trauma-informed practice. In this clip, we see the dentist communicating with the patient in a way that invites her to have as much power as possible within the situation. By working with her to provide choices around things such as documentation, the strategies around minimising triggers, asking for her advice around those strategies before providing her own, but also asking permission to take clinical photos. As victim survivors of domestic and sexual violence have experienced power and control from perpetrators, being provided with opportunities to have power and control over choices and decisions that impact their lives can help them to reclaim their power. There is a caution. It is important that as dentists, you recognise that you carry an inherent level of power and authority in your role, and will need to consciously engage to counter this power with vulnerable patients. Next slide, please. We're moving into looking at the final clip from the Unintended Consequences video.
Hello, how are you? Who have we got here?
Yeah, hi. We have a 12 o'clock for Josh here.
Josh, how are you? Welcome. Josh, have you been here before?
Yeah, a long time ago.
While the appointment is for Josh, Trevor is driving the conversation for him. Even when the receptionist tries to speak to Josh directly, Trevor ends up speaking for him. Before telling him to sit down and wait, Trevor is not listed as a designated carer. After they're both seated, the receptionist sees that Josh appears anxious, with Trevor feverishly whispering to him and squeezing his leg. The receptionist makes a note of this privately to the dentist, mentioning an interesting dynamic between the two of them. The dentist, after receiving this note, comes out to collect Josh for his session.
Josh, you're up next. Hi, Josh. How are you today?
Good.
Trevor. Hi, Trevor. Good to meet you. We're a bit short of space in the cubicles, so unless you're the registered carer, I'd ask you to take a seat in the waiting room. We'll call you when we're
Josh
over.
needs me to be with him. He's got a big dental anxiety, you see.
You're happy with that, Josh?
I need him to come.
Oh, well, okay. If Josh is happy with it, then come through with me, okay?
The dentist leads Josh to the OPG room. They are now separated from Trevor, providing a potential opportunity for the dentist to ask some screening questions around domestic and sexual violence. We invite you to pause and reflect on what some of the unintended consequences might be in this situation. We may not be aware of the outcomes of our actions or inactions when working with those experiencing domestic and sexual violence. It is important to think critically and be aware of potential unintended consequences, and always aim to prioritise patient safety.
So as mentioned earlier, the theory, practice and principles that underpin these educational resources are evident and consistent across the different resources. For example, in this video that was focused on unintended consequences, we also saw demonstrated well the principle of trauma-informed practice around the importance of a whole of clinic approach. The concept was demonstrated here within this video, while the content around this is covered in the trauma-informed print resources. So you can see how they support each other with those cross-references. Next slide, please. If the potential perpetrator is present, it's important to be mindful not to unintentionally align with or collude with them. Perpetrators can behave in ways that encourage and support collusion. For example, in this clip, we see the perpetrator trying to engage the dentist in their abusive behaviours towards the victim survivor when goading about the big dental anxiety. Our dentist stayed focused on the victim survivor and their choices and what their needs were. However, had they tried to be light and engaging by laughing along with the perpetrator, this would have sent the wrong message to both victim survivor and the potential perpetrator. Next slide, please. There is no ABC 1, 2, 3 approach to responding to domestic and sexual violence, as what may increase one person's safety could increase the risk of another person. Therefore, critical reflection is vital. An essential focus for the reflection can be exploring what is informing your action or inaction in given situations. As shown here in the critical reflection section of this print resource, we would encourage you to catch actions that are informed by a sense of needing to fix or rescue. Given that dentists' role is to fix and find dental solutions, this approach may too easily inform your practice when it comes to domestic and sexual violence. So please stay mindful. Next slide, please. Although we have provided a flowchart in the print resource to guide possible intervention, if a potential perpetrator is present with the victim survivor, critical thinking is still essential to avoid unintended outcomes. There are points along the way where you'll need to maintain critical thinking and reassess the information you are receiving and the indicators you're observing. That critical thinking about why we are taking action can be particularly helpful in this situation, as it is not always safest or in the victim survivor's best interest to have the conversation now, even if you can separate them from the potential perpetrator. And as we saw in that short clip, there are two different ways that possible outcomes or possible endings to that scenario. And we need to be very mindful and reflective around how our interventions, whether they are an actual action or not taking action, can potentially impact that person who has to go home with that perpetrator at the end of the session. Next slide, please. So each video contains much detail, and although there is a focus on specific learning outcomes in the print resources, it is acknowledged and encouraged that educators may choose to develop their own content around videos to highlight or focus on different areas. For example, the list below explores how a shift in focus could open a deeper exploration in the following areas, to name just a few. So within considering unintended consequences, you could also explore working with LGBTQIA+ patients. Within ethical or legal and ethical considerations, you could shift the focus to working with culturally and linguistically diverse patients. And working with First Nations Australians, you could refocus to explore the experience of dental students responding to domestic and sexual violence when supported by an unhelpful supervisor. Given that training in this area is new to dentistry, many students may find themselves in situations where they have more knowledge and skills in appropriate responses to domestic and sexual violence than their supervisors. So this will be a key part of learning as we move forward in this space. However, most important it is to remember that we are not training dentists to be DV workers or counsellors, and the focus is still on the safely and compassionately completing standard dental care with a trauma-informed perspective, responding to and recognising domestic and sexual violence. Finally, the resources are so densely packed with great content that this evening we truly have only been able to offer you a small taster. So we invite you to take a closer look at the full suite of resources and print resources in your own time. Thank you. I'm going to hand back to Felicity now.
I was just going to mention that within the video scenarios, the dentists are played by JCU graduates who are now dentists and former JCU staff, former and current JCU staff, whereas the patients are played by trained actors. So that is why you may see some difference between the two within their performances. But it's so wonderful to have all of these JCU graduates and who are now dentists and staff participating in these videos. Now, how to find these? You'll see there that there is a screenshot of what you'll actually see when you go to the College of Medicine and Dentistry homepage. Down that page, you'll see one of the tiles will say Dentistry Identifying DV Modules. Easy way to find that would be to click on the QR code, which is on the screen there. There's also a link there just to the JCU Medicine and Dentistry page. So those resources are now available both as videos and as print resources. Could you please change the next slide, Bree? Thank you. We'd also like to invite you to provide feedback, both on this webinar. There's a QR code, as you can see there, that will take you to the feedback survey on the webinar itself. It really helps us to know what was useful in this webinar and what we could do to improve them in the future. As there is a research project that sits alongside the development of these resources, we would really like to have some of you participate in our evaluation phase. So we invite you to join us for either the focus group, and you'll see there that we've actually put up the date of the focus group, which will be on Tuesday, the 20th of August, between 6 and 7 p.m. Same day, but different date as this. So we'd very much like to have some of you join us at the focus group. We will also be distributing a survey which will allow you to provide anonymous feedback on the resources themselves. So when you provide your webinar feedback, if you could just let us know with your email address if you're happy to participate in that next step and contribute to the evaluation. Otherwise, just drop me a line. There's my name and email address there, and we'll provide you with further information about the research aspects of the study or any other questions that you've got about it. We're very happy to provide that information to you. So thank you very much for participating. We're now just going to go to the questions. Simone, do we have some questions?
To start off here and say thank you very much, Dr. Felicity Croker and Dr. Anne Carrington, for what you presented so far, and for our guest speakers who have so generously been here with us today. And again, thank you also for the participants for you joining us this evening to look at this launch of these innovative resources. So as I've been introduced, I'm Simone Dewar. I'm a social worker and have been the research assistant for this project. And we'd be really interested to hear your questions as you're here with us live. And if you have any other questions that you'd like to ask, to us as the project team, we can certainly speak to that in this webinar together. There's no questions that's come through right at the moment, so if folks might want to put something in the question and answer box, or if you feel to, you can certainly unmute yourself and you could hear your question live. Myself, Felicity, and Dr. Alex Dancia, who is our dentist and bringing an extensive range of skills, academic skills, practice experience to these resources, are all here, and we'd be really interested to be able to respond to the questions. Okay, one question's coming through. Oh, thank you. So we appreciate that feedback. These are excellent courses. Kudos to the team, really appreciate that feedback. We're also open to critical reflection and talking about what we're doing well, and also, again, as we're saying through the upcoming focus group and the survey, to be able to identify areas that we can improve for next time. So thank you for joining by video, Alex and Anne. One other comment in here. Actually, Alex, you're responding to that already, so that's great. So again, just inviting our participants. I know it's the end of the workday, and you might still be digesting what it is that we've presented so far. But again, just want to offer that opportunity if anyone would like to say anything, anything here.
You don't seem to have any more questions coming in, but people can always contact us if they have any further questions. Have had a chance to meet us, you can see the team on screen, so please feel welcome to contact us if you've got any questions and don't feel like popping them out there today. But I just did want to say thank you as well. Thank you to the team. Thank you for all of you for attending, and that together we can improve dental experiences and outcomes of victim survivors of domestic and sexual violence. So thank you all for attending tonight.